Good morning, everyone, and welcome to our CanSim presentation. We'll be focusing on Alzheimer's disease and cognitive decline. CanSim is interactive, so we will be pausing to ask questions with the class. We hope you enjoy our presentation. Firstly, I'd like to move through our case study, just explaining a little bit of background on our main patient, who is Elvis Presley. Elvis is 65 years old and did not die at age 42, as most of us would believe. We're going to use his daughter, Lisa, has reached out to gerontological specialized nurses at the Community Resource Center, so that's us and that's our setting, to discuss further cognitive decline and different intervention strategies. We hope you enjoy our presentation, and please feel free to ask questions as we go through this video. Thanks.
Hello there, this is Kevin with the Home and Community Resource Team. How can I help you?
Hi, thanks for meeting with me. I'm pretty worried about my dad, Mr. Presley. He's 66 years old, and I've just been noticing a lot of changes in him recently.
Okay, yeah, of course, we're here to help you. Can you tell me more about what you've noticed in your dad?
I think over the past 3 months, he's become pretty forgetful. He keeps misplacing things around the house. He's been forgetting about appointments and sometimes can't remember conversations that we just had. And it's getting worse, and I'm pretty concerned about his safety, especially since he's also had a couple of falls too.
Okay, can you tell me more about those falls? Was there anything that caused those falls?
Well, he says they happened because he left things on the floor and forgot they were there and then tripped over them. And he kind of brushes it off like it's not a big deal, but I'm really scared that he can actually hurt himself.
Okay, I understand. Has he mentioned any other symptoms like problems focusing or changes? Have you noticed any changes in his mood?
Yeah, actually, he used to be super active and social. He was always practicing his guitar and singing with his friends and stuff. He used to be a famous rock musician, so music has been a big part of his life. But now he says he can't concentrate enough to play like he used to, and he hasn't been seeing his friends as often. He just seems less like himself.
I see. And how has he been feeling emotionally? Have you noticed any changes in his mood?
I think he's down, even though he says that he's fine. He doesn't get excited about things anymore, and it kind of just feels like he withdraws from the things that used to make him happy, and it's just not like him at all.
I hear you. That must be really hard to watch your dad go through this. It sounds like he might potentially be experiencing some cognitive changes and some possible changes in his mood. Have you talked to him about seeking more support or seeing a specialist?
I have, but he thinks that I'm overreacting, and I don't want to push him, but I'm really scared that he could hurt himself again or that this could get worse without help, and I just don't really know what to do at this point.
Okay, I understand. Based on what you described to me, it would be a good idea to bring your father in, and you'd be more than welcome to come with him. And we can start doing some assessments and kind of exploring some options for support for your dad and you.
Okay, that sounds good. Yeah, I just want to make sure he's safe and getting help that he needs, and I just want to know what I can do to support him.
Yeah, absolutely. We'll definitely make sure he gets the help that he needs, and we can connect you with some caregiver supports and resources. The first steps will be kind of booking an appointment. We got an appointment next Monday that you guys can come in together, and we can go through a more thorough assessment together, if that works for you.
Okay. Yeah, that sounds good. I appreciate your help. I just want the best for my dad.
What are our main concerns after this phone call with Jane? That's right, cognitive decline, falls, and caregiver burnout.
Hi, Mr. Presley and Jane. I'm Kevin, the nurse you spoke with last week. Thank you guys for both coming in today. We're here to talk about some of the changes that you've been experiencing, Mr. Presley, and see how we can support you.
Thank you, but I don't think it's necessary, but my daughter insisted.
I think it's worth looking into it.
Okay, that's very understandable, Jane. Mr. Presley, I'd like to ask you a few questions so we can kind of get a full picture of how you're feeling and how things have been going for you lately.
All right.
Okay. So Jane mentioned you've been having some troubles with your memory lately. Can you tell me a little bit more of that from your perspective?
Well, I'll admit I've been forgetting a few things here and there. Like sometimes I'll leave things out and forget about appointments. And I've missed an appointment or two, but nothing too serious, you know? I just get a little distracted.
Okay, I see. And so Jane was also telling me you've had some recent falls. Can you tell me a bit more about those?
Yeah, there's just some small trips, really. I left some things out and I didn't see them. I know Jane worries, but I'm alright.
I know you're okay now, but I'm scared that it'll happen again.
Understand. It sounds like you're pretty used to being pretty independent, Mr. Presley. And Jane, it's natural to be concerned. Especially with these recent changes, Mr. Presley. Can you tell me if you've noticed any changes in your ability to focus or do things you enjoy?
Well, yeah, I noticed it's been harder to concentrate. I used to practice a lot. I used to be a real rock star back in the day, but I don't feel as sharp. It frustrates me sometimes, but I try not to think about it too much, you know?
Yeah, that must be tough. It sounds like music is really important to you. Jane mentioned that you're quite involved with the local music community.
Yeah, music has always been my passion. I used to play with friends all the time, but lately I just don't feel up to it. I've been staying home more. I guess you could say I'm in a bit of a slump.
That's understandable. Many people experience these changes in their social life and interests when they're dealing with things like memory and concentration. It is also common to feel down and discouraged during these times. Do you feel comfortable talking about your mood? Have you noticed any changes?
I feel a bit low lately, but I was just hoping that would pass.
Well, it's okay to talk about it here. I think it's part of why you haven't been feeling like yourself lately.
Yeah, it's very common, Mr. Presley, and we're here to help. There are many ways we can address these changes and help you feel like yourself again. We can run some tests and do some assessments here and see what the next steps forward are for you.
All right, I'll admit, I'd like to feel more like my old rock star self again. Get back into playing music. So what's next?
What are some symptoms of cognitive decline that Mr. Presley expressed? That's right, forgetting appointments and not playing his guitar as often.
Hello, my name's Emily. I'm one of the nurses working with Kevin today, and I was just looking to do a couple assessments. Our first assessment is called the mini-cog, and it's just going to test your memory.
Okay.
Is that okay? Okay. So for the first activity, I'm going to read you a list of words, and then you're going to repeat them back to me. So your first set of words is banana, sunrise, and chair.
Banana, sunrise, chair.
Okay, that was really good. And then for the second part, I'm going to get you to draw a clock. So I'm going to flip the page over and I'm going to get you to go and draw your clock and set the time to 10 past 5. Okay, good. And then we're just going to go back and I'm going to get you to repeat those 3 words again from the very beginning of the test. Do you remember what those words were?
One of them was table, chair, banana.
Okay. Yep, that was good. All right. And that was the end of the mini-cog. Next we'll move on to the Montreal Cognitive Assessment.
Mr. Presley scored 22 out of 30 on the mini-cog assessment. What do these mini-cog scores indicate? That's right, Mr. Presley has trouble remembering things, and he is expressing symptoms of cognitive decline.
Okay. Okay, we'd like to just explore a little bit further. So we have another assessment tool here. This one's called the MOCA tool. So for this activity, you'll just follow the pattern of the numbers and letters, and I'll give the pen to you and you can start working on that.
Mr. Presley scored 19 out of 30 on the MOCA assessment. Why did we do more than one cognitive assessment? You got it. We wanted to accurately identify patient condition.
Okay, so based on our screening tools and our assessments that we've done today, we'd just like to go ahead and do a couple more tests, one being a urine sample, just to make sure that you don't have any infections and that could be causing your confusion. And then secondly, we would like to do some other scans, including an MRI and a CT scan, just to get a better understanding of what is going on, and to make a diagnosis for the physicians. Additionally, we were thinking that home support would also be beneficial to you. What do you think about that?
Yeah, if you think that can get me back to my rock star lifestyle, what do you think, Jamie?
That would be great.
Yeah.
Okay. Okay, so we'll make a note of that and we'll look into some resources in the community for you as well. Do you guys have any other questions for today?
No.
No?
I don't think so.
Okay. Well, it was nice meeting you, and
Thank you.
yeah, we will follow up with you with the following tests.
Okay, sounds good.
What else could be causing confusion other than cognitive decline? That's right, infection or injury.
Hey Haley, I just wanted to check base with you quickly before you guys left our appointment today. I just want to go through a bit of assessment and see how you're doing, because I know like this can be quite challenging for you to have a loved one going through something like this. So we're just going to go through a caregiver stress assessment checklist, okay?
Results show Jane is experiencing stress and caregiver burnout. Why is caregiver burnout a concern? That's right, extreme stress and depression may be life-threatening.